Hi again, Tiffany Hall. Now I'd like to review a quick overview of our intraoperative considerations and perioperative anemia management. I'm going to highlight the key strategies used during surgery to minimize blood loss, preserve a patient's own blood, and optimize oxygen delivery. All of these are central goals for patient blood management and surgery. So why are intraoperative considerations important to the perioperative anemia management patient? Surgery often leads to blood loss, and for patients with anemia, this can worsen their condition, increase their complication risks. That's why managing anemia during the operation is critical. It reduces the need for blood transfusions, which carry risks such as immune reactions, infections, and increased hospital stays, and ensures that the body continues to get all the oxygen that it needs. So what are some key strategies and clinical practices that we can use in surgery? First is minimizing blood loss. Surgeons can use techniques such as meticulous hemostasis, electrocautery, minimally invasive approaches, and hemostatic agents and controlled hypotension, all to use helping manage bleeding. Preventing hypothermia is essential. Cold temperatures can impair the body's ability to clot and increase blood loss. Second, blood conservation techniques are important. There are several methods that help preserve a patient's own blood during surgery. Cell salvage or cell recovery, also known as intraoperative autotransfusion, collects and reinfuses the patient's own red cells. Acute normovolemic hemodilution involves removing and storing blood at the beginning of the procedure, and then replacing it with fluids and reinfusing that to the patient later. Tranexamic acid, or TXA, helps to reduce bleeding by stabilizing blood clots. And then transfusions are only used when necessary, absolutely necessary, following a restrictive transfusion strategy for patients. Third, we want to optimize coagulation. So it's important to use point-of-care testing such as TEG-ROTEM to help assess clotting and clot function in real time, guiding targeted therapy with platelets, plasma, or coagulation factors only when needed. Fourth are anesthetic considerations. Anesthesia plays a key role in ensuring oxygen delivery, and this includes managing fluids carefully, optimizing ventilation, and maintaining oxygenation, even when the hemoglobin levels are low. And fifth, and very important, is communication. Communication and team-based planning. We know that effective intraoperative patient blood management requires coordination. Surgeons, anesthesiologists, and transfusion teams must plan together to define transfusion thresholds and communicate throughout the procedure. Real-time monitoring of vitals and labs help to guide these decisions and ensure patient safety through the procedure. So in summary, the goals of intraoperative patient blood management are to improve patient outcomes, reduce transfusion-related risk, conserve blood resources, enhance surgical safety and cost effectiveness. And we know that intraoperative strategies are a vital part of perioperative anemia management and protecting our patients, improving outcomes, and preserving one of the most valuable resources, their own blood. Thank you for watching, and I hope you will read the written content that goes along with this video.